Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And welcome to another edition of Medicare Moments with your favorite Medicare Moments host, Toni King. Hi, Toni.
How you doing, Jim? So I am sitting here and I'm telling you, Medicare is exploding right now. Things are changing and we need to let our listeners know what's going on because it's a new year.
And that's why we're really happy for the people that listen to your podcast every week. And we can look at those numbers, Toni, and they're really great. You're to be congratulated on that. And folks are listening and they're taking Toni King's advice, and they're also visiting your website at tonisays.com, which makes us very happy as well. Well, Toni, today the question is, isn't Medicare Part A free? Toni, is anything free?
Well, people think it's free, and they just really do not know what Part A is formed. They don't know how Medicare is formed. Not everything is always free. So why don't you tell them what the question is? What's going on?
Well, today, Toni, you hear from Terry in Laredo, Texas, who writes, Toni, I need your help because I've made a mistake enrolling in Medicare. This February, my husband, Sonny, was laid off and lost his employer health insurance, which I was on. He is a veteran and is receiving his health care from the VA, so he did not have to enroll in Medicare, and his health care is not costing us anything. I have enrolled in Medicare since I'm turning 65 in April. But I'm not sure if I enrolled properly because my Medicare is costing me an extra $505 for Medicare Part A and $174.70 for Medicare Part B. Isn't Medicare Part A free? I have not worked very much since Sonny and I married 40 years ago, and Social Security said that is my issue. Please explain what I should do to correct my Medicare mistake. Thank you, Toni. Terry from Laredo, Texas. So can you help Terry in Laredo, Texas, Toni?
Yes, I can. I can help Terry. And what Americans need to realize is that Part A is not free. It's at no cost to us. But the reason why it's at cost is because you worked a certain amount of time and they took those taxes out of your check. That's where the Medicare tax goes. And Terry did not work. She was a stay-at-home mother and she did not work. So she can be on her husband's Medicare. And that is why it is so important to get married. That's where that marriage license goes. I mean, people don't realize that. Domestic partners are just being single and living by yourself. You don't have someone to lean on.
So what you're saying is, if you're working, you have to work. To qualify for this, you have to work for at least 10 years or 40 quarters. Is that correct?
Correct. To get Part A at no cost.
But then there's a graduated scale I see here as well. So in 2024, they say if you worked for 30 to 39 quarters, then you have a rate associated with that, correct?
Correct. And for this year, it's $278 a month. So Part A is not free. You pay $278. But if you work less than 30 quarters, then your Part A will be $505 a month. And that's why Terry's is $505 because she went online, enrolled in Medicare, and did not tell them she was married. And they charged her.
And it's important to say this as well, because Toni says this all the time. And that is that as administrations change or as years change, administrations change Medicare. And every year there could be a different number. And I see here that you note that it's $1 less than it was in 2023, which isn't really a big deal. And those are little changes. But that's another reason why it's important to listen to Medicare Moments with Toni King, because you get the latest, most up-to-date information about how Medicare is today when we're doing this podcast.
That's right. And it is so important that you work 10 years or 40 quarters, or that if you're married, your spouse worked 10 years or 40 quarters, and you can be on their Medicare, and you have to take your marriage license to the Social Security office to show them that you're married.
Then if it's a married couple, one of them is a stay-at-home, one of them is working, they do the 40 quarters, both of them have the benefits of the 40 quarters.
Correct.
Okay.
And they both go under that married spouse's Social Security number, and they use that number. Your Medicare number will not be your Social Security number. They've changed that, but that's what they use. They use your Social Security account. They verify everything and make sure that you're married and you have worked 10 years or 40 quarters. There's 4 quarters to a year. So you've got to work 10 years or 40 quarters.
Correct. They don't have to be consecutive, but in your lifetime, you have to work that so that you paid into the system, and then the system can pay you back.
And if you don't, then you have to pay for Part A. And that's just how the whole thing works. So all of this is in Chapter 1 of my Medicare Survival Guide, Advanced Edition. The rules on how to enroll in Medicare is all there. And it's very important. They can find my book on the website, which is ToniSays.com, ToniSays.com. So that if they want to know how to enroll, what are the rules, that's what's going on. That's where it's at.
And Toni has put together this website, and there's a lot of helpful Medicare enrollment aids on this website. There are webinars that you can take advantage of. Toni's worked very hard putting them together for you. There are books that you can buy, and she's bundled some packages so you can actually save money. And you can even give her office a call at her 24-hour-a-day Medicare helpline, 832-519-8664, 832-519-8664. And if someone's not there, leave a message, and shortly someone will call you back and help you out. You're listening to Medicare Moments with your host, Toni King, and we'll be back right after this.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome back to Medicare Moments with your host, Toni King. Today, Toni took a question from Terry in Laredo, Texas, and it has to do with Medicare Part A. Is it free? And why am I paying $505 a month? And it all gets back to what you contributed to the system, right, Toni?
That's right. And we need to let them know what Part A is. There's 2 parts to original Medicare. There's Part A and there's Part B. Medicare Part A is your inpatient hospital stay. That's what triggers you getting on Medicare, Part A. Part B is your outpatient surgery, your MRIs, your CAT scans, your doctor doing surgery. That's very important. But you want to make sure that you do work or your spouse works enough quarters to where you get Part A at no cost, so you don't have to pay that additional premium. And nobody wants to pay extra, but sometimes you have to. I mean, people don't know what to do.
As you always say, planning is the best for everyone, and planning to try to get those 40 quarters in one way or another throughout your lifetime is good. And that's why we'd like you to share this podcast with other folks who may have the similar questions, right, Toni?
That's right. And I now have my video series. If someone doesn't have time to do a consultation or they're confused, they can go online and purchase the video series, and it will tell them everything they need to know about Medicare, all the different situations. And that's at my website, which is ToniSays.com. I'm Toni with an I and not a Y, because why, Jim? I am a girl.
And Toni says all the time, remember, folks, with Medicare, what you don't know will hurt you. And that's why she's here to help America through all their Medicare needs. ToniSays.com. You can call that number 832-519-8664 or email info@ToniSays.com, because Toni loves your questions. Right, Toni?
I learn from the questions. I get questions and I put them in the newspaper. That's how I learn different things that are happening around with Medicare.
Toni is in about 100 newspapers a week. She's all across America, all across the fruited plains. You can read her column. If her column's not in your local newspaper and you'd like her in there, drop Toni an email and she'll work on that too. No promises, but we'll do the best we can. Visit her website, ToniSays.com. And we look forward to seeing you on the next Medicare Moments podcast. Right, Toni?
That's right. And I will see you later, Jim. This has been fun. Okay, let's just go out and help America understand Medicare. In 2009, I met a gentleman who was giving wrong information about Medicare, which cost him over $10,000. After helping him, I knew that it was up to me to start advocating for America. Hi, I'm Toni King, host of Medicare Moments podcast. Join me every Wednesday as I share tips, strategies, and little-known facts I've learned over the past 20-plus years. I put Medicare into people terms, and I want to help you personalize your Medicare, because with Medicare, it's what you don't know that will hurt you. Medicare Moments is available now anywhere you listen to podcasts.